George was wondering what was up with the hepatitis B vaccine since his nephew, baby Endor, was born and they wanted to give him the vaccine. George also wants a tattoo, and this is an important topic for that also.
It's Doctora Victoria and George.
Over 295 million people are carriers of the hepatitis B virus worldwide, with over 800,000 deaths annually from hepatitis B-related liver disease. We have vaccinations for this, but there are also treatments should someone still develop this disease. As many of you know, the term hepatitis is used to describe a common form of liver injury. Simply put, hepatitis means inflammation of the liver. Hepatitis B is a specific type of hepatitis caused by a virus. I shared how prevalent the disease is worldwide, but there is good news. Hepatitis B infection can be prevented through vaccination. These vaccines are safe and highly effective in preventing infection and now are routinely given to newborns and children in many countries. For those who do develop chronic hepatitis B, several medications are available for treatment. How does someone become infected with the hepatitis B virus anyways? There are several ways. One is through the use of contaminated needles. This can happen if people who use injection drugs share needles or syringes. It is also possible to spread hepatitis B through tattooing, hence why George is interested, acupuncture, or body piercing if these procedures are done with contaminated instruments. You can lower your risk by ensuring your practitioner follows careful sterilization procedures. Another common way to become infected with hepatitis B is through sexual contact with someone who is infected. If you have a regular sexual partner that's infected with hepatitis B, they should be tested for the infection and vaccinated if necessary. Hepatitis B can also be passed from mother to infant during or shortly after childbirth. Having a cesarean birth does not prevent the virus from spreading. Experts believe that breastfeeding is safe for mothers with hepatitis B. To prevent transmission from mother to infant, all pregnant women should be tested. Hepatitis B can also be spread through close personal contact. This could happen if blood or other bodily fluids get into tiny cracks or breaks in your skin, in your mouth, or eyes. The virus can live for a long time away from the body, meaning that it can be spread by sharing household items like toys, toothbrushes, or razors. However, it is not spread through touching, shaking hands, or sharing a meal or cooking utensils. Nowadays, it is extremely rare for hepatitis B to be spread through blood transfusion or organ transplantation. Blood and organ donors are carefully screened for markers of hepatitis infection. In the hospital, hepatitis B virus can be spread from one patient to another or from a patient to a doctor or nurse if there is an accidental needle stick. It is rare for a doctor or nurse to pass hepatitis B on to a patient. Wearing gloves and washing hands can help to prevent spreading the virus. Discarding needles and syringes after use and proper sterilization of surgical equipment also helps prevent the spread. Now, let's talk about the symptoms of hepatitis B. Symptoms vary and can include a flu-like illness with fever, abdominal pain, fatigue, decreased appetite, nausea, and in some cases, yellowing of the skin and eyes, called jaundice. In severe cases, liver failure can develop, characterized by jaundice of fluid in the legs or abdomen, called ascites, and some confusion. However, many people do not develop symptoms, particularly if the infection occurs in infants and children. Not having symptoms does not necessarily mean the person is not infected or that the infection is under control. Most people with chronic hepatitis B have no symptoms. The likelihood of developing chronic hepatitis B depends largely at your age at the time of infection. Chronic infection develops in about 40% of children who are infected at birth, in 20 to 50% of children who are infected between the ages of 1 and 5, and in less than 5% of people infected with hepatitis B during adulthood. Now, let's talk about the risk of developing complications, such as cirrhosis, liver failure, or liver cancer. This risk depends on how rapidly the virus multiplies and how well your immune system controls the infection. For people with chronic hepatitis B, the risk of developing complications is higher in men than in women and increases with age. The risk is also increased by drinking alcohol, having chronic hepatitis C or D, or having an HIV infection. Being overweight or having diabetes can increase the risk of fatty liver, which can increase the rate of liver disease progression in people with hepatitis B. So, what about the treatment? Specific treatment for acute hepatitis B is usually not needed, since in about 95% of adults, the immune system controls the infection and gets rid of the virus within about 6 months. In people who develop chronic hepatitis, an antiviral medication may be recommended to reduce or reverse liver damage and prevent long-term complications. However, not everyone with hepatitis B needs immediate treatment. If you do not need to start treatment immediately, you'll be monitored over time to know when hepatitis becomes more active, and antiviral treatment may begin at that time. Once you start treatment, you will have regular blood tests to see how well it is working and to detect side effects or drug resistance. Monitoring will continue after finishing treatment. Like I said earlier, the majority of people with acute hepatitis B spontaneously clear the infection. Those who develop chronic infection should see a doctor with expertise in liver disease, such as a gastroenterologist or hepatologist, to discuss treatment options. Everyone with chronic hepatitis B should be vaccinated against hepatitis A, unless they are known to be immune. Influenza vaccination is recommended once per year, usually in the fall. People with chronic hepatitis B should also be vaccinated against COVID-19. The COVID vaccines are safe for people to take with chronic hepatitis B. People with cirrhosis may have more severe illnesses if they get COVID-19, and some medication used to treat severe COVID-19 may make hepatitis B virus more active. People with liver disease should also receive other standard immunizations, like diphtheria and a tetanus booster, every 10 years. Regular screening for liver cancer is also recommended, particularly for older individuals, those with cirrhosis, and people with a family history of liver cancer. In general, this includes an ultrasound examination of the liver plus a blood test for alpha-fetoprotein every 6 months. No specific diet has been shown to improve the outcome in people with hepatitis B. The best advice is to eat a normal, healthy, and balanced diet and maintain a normal weight. Alcohol should be avoided since it can worsen liver damage. Just to clarify, all types of alcoholic beverages can be harmful to the liver. People with hepatitis B can develop liver complications even with small amounts of alcohol. Smoking is harmful for your health in general and should be avoided. For tips and treatment on quitting smoking, see here. George quit that habit earlier. In addition, smoking has been shown in some studies to increase the risk of liver cancer. Exercise is good for overall health and is encouraged, but it has no effect on the hepatitis B virus. Exercise is not harmful to the liver, even in people with chronic hepatitis or cirrhosis. Get your 150 minutes in every week. Many medications are broken down by the liver, so it is always best to check with your primary care provider or pharmacist before starting a new medication. As a general rule, unless the liver is already scarred, most drugs are safe for people with hepatitis B. An important exemption is acetaminophen, aka Tylenol. It's also in a lot of combination medications over the counter, so make sure you check before you're just picking things up. The maximum recommended dose in people with liver disease is no more than 2 grams or 2,000 micrograms or 4 extra strength tablets or capsules in 24 hours. Many of the over-the-counter cold and headache medicines under different names may contain acetaminophen, so make sure you're checking and reading the labels. No herbal treatment has been proven to improve outcomes in people with hepatitis B, and some can cause serious liver toxicity. Herbal treatments are not recommended for anyone with hepatitis B. Some people find it helpful to connect with and get support from others living with hepatitis B. A number of organizations are available all around the world. There is so much to discuss when it comes to hepatitis B. This is really just the tip of the iceberg. Thank you for joining me today, my healthcare team. We hope to see you next time and see what George and baby Endor gets up to next. Bye-bye.